All right, so welcome again to another brief talk on methods for thinking through different fundamentals on NCLEX, both RN and PN. So today we're looking at arterial blood gases, and I'm going to hopefully guide you through a quick way to think through interpreting them. All right, so here we have notes that are going to take us out to a very nice graphic or a couple of graphics in nurses' labs that might help us a bit with interpreting. And there are a set of practice questions that go along with this uh, little mini lecture. So you can also find those here on the teacher notes or the notes that I've shared with you regarding dosage calculation, or on the notes, the Google Doc notes themselves. You can just click here for the interpretation guide in nurses labs, or you can scroll down and click on the Google form hyperlink here to get to the practice questions that come at the end of this talk. All right, so let us go ahead and click here on the link. It will then take you out to nurses labs. All right, and here on nurses labs you'll see lots of ads, but you will also see a really nice primer on arterial blood gases, and it's using the tic-tac-toe method. So that's where we're going to focus today, on the tic-tac-toe method. Okay, I think it's pretty good as a method in terms of helping you to make the best decisions and choices you can on NCLEX, right? When it comes to those questions asking you about whether or not the patient is experiencing an acidotic or alkalotic state, and if so, if the patient's in metabolic alkalosis or acidosis, or respiratory alkalosis or acidosis. Let us start with a couple of ideas. Right, we just have to stabilize a little bit here. Let's start with a couple of definitions that are going to get us started on our way. And then we're going to go through a process that I believe will get you to where you need to be on these questions every time. Okay, so what is arterial blood gas? So there's a definition given here. But I say, for the sake of the NCLEX, these questions are generally easily identified. I'm just going to show you really quickly here um, the way they typically look, right? They give you some information in the question, and then they ask you four designations, which one you might interpret this situation that's describing, generally a patient who's having a certain clinical presentation or set of symptoms that you're going to interpret. All right. Often you will get in these questions, oops, didn't really mean to do that. All right, you'll get in these questions, there's a little better representation of it there. You'll get in these questions a way to uh, show the algorithm what these numbers mean. All right, so sometimes you'll get a pH, maybe a PaCO2. All right, you'll get an HCO3 or bicarb value. Do you know what those numbers mean? And from those numbers and patient scenario or patient uh, signs and symptoms or clinical manifestations, can you base upon those assessment findings? All right, you come up with an answer. All right. We're going to go over these questions a bit on the back end. All right. But I want to start with the question so you can get a sense of the type of questions that I'm talking about here as we go back to nurses' labs, where we're going to explore these components of arterial blood gas really quickly. All right. Before jumping into the tic-tac-toe formula. All right, so first we'll start with pH. Most of us know the normal range for pH, all right? And pH kind of refers to the number of hydrogen ions that are present in blood, all right, or any bodily fluids. So generally they're drawing our blood or drawing the patient's blood or collecting arterial blood for these ABGs. So they can really get a sense of, the arterial blood is going to be the blood that is just coming away from the aorta. So therefore it's going to be oxygenated. So we want to see just, well, how much oxygen is in that blood? What are the pressures of oxygen and carbon dioxide, so we can kind of get a sense of how this person is respiring. Okay, so if that's, or ventilating more appropriately, right? Because inspiration and expiration make ventilation. All right, so that said, PaCO2, well, pH, we started there. Normal pH, basic, right? 7.35 to 7.45. Seems like a somewhat tight range, but it's kind of good that it's 7.35 and 7.45 because it gives us a little bit of a clue as to how we might think about the partial pressure of carbon dioxide. All right, with the 3.5 and 4.5. So kind of put a pin in that, but you already know this, right? Let's move. Well, let's just mention that acidosis, generally speaking, is going to be the smaller pHs under, right, 7.35, whereas the alkalosis or alkalotic readings will typically be 7.45 or better or higher. Better use good language here because I don't want to confuse you. All right, so 7.35 or lower, 7 point will be acidosis. 7.45 or higher or greater will be alkalosis. All right, I'm going to get it together here. All right, so partial pressure of carbon dioxide comes into play, and look at the normal range for that. We're really kind of honing in on the normal range, 35 to 45. All right, but there's something inverse here going on. So I got to point this out to you, right? Because 35 or less will not be acidotic, okay? 45 or greater will not be alkalotic. So get that out of your head, okay? But carbon dioxide or the partial pressures of carbon dioxide will be the way we determine that something is either respiratory alkalosis or respiratory acidosis, okay? So this is the respiratory determinant, partial pressure of carbon dioxide. All right, moving on to partial pressure of oxygen. It's nice to know this one, but typically on NCLEX, if they're giving it to you, it's an additional number that they're giving you that's not necessarily going to be essential in you making the proper selection regarding the patient's state. Okay, so I say that because the normal range is 75 to 100. And that kind of really overlaps pretty well with the oxygen saturation, which is typically in normal range 94 to 100%. All right, so take a note though that oxygen saturation, or the SpO2 or the SO2, is speaking of the amount of oxygen in the blood that's binding with hemoglobin, and that's basically taken by pulse oximetry. Okay, so 94 to 100. Well, we usually don't like to tolerate much less than 98 in the clinical environment, right? But we learned through COVID-19 that people can walk around and, ambulate without problems, or, well, definitely with problems at uh, SO2 or oxygen saturations lower than 98, right? So with that said, 94% is where we're really thinking about putting that person on a ventilator. So the normal range for oxygen saturation, I want you to keep it at about 94 to 100, okay? Um, Try to keep it there before we're really worrying about this patient being, um, you know, healthy or, their state being synonymous with being alert and oriented. All right, times 4. With that said, the partial pressure of oxygen is tolerating a lower range, right? 75 to 100 millimeters of mercury. So that represents its pressure. All right, so This, though, is the amount of oxygen available to bind with hemoglobin, and it's generally measured directly from the blood, all right, when you're during that arterial draw here. So it's not really referring to what's measured in the tips of the fingers, it's really measuring what's present there and binding in the blood, all right? So the normal range is 75 to 100. Okay, those aren't as important, though, as the pH, all right, the partial pressure of carbon dioxide, 35 to 45 as a range, all right, and then here bicarb, all right. This one, typically NCLEX is going to give you these three, all right, these three without fail. They're going to get, do you need these three in order to determine how you're going to measure or measure up the patient's acidotic state, all right. So let's see. HCO3 refers to the bicarbonate ion. All right, so this is where the patient becomes more alkalinic. All right, or the patient's blood or other bodily fluids become more alkaline. All right, so it's connected to generally the kidney and what the kidney is doing to release this ion. All right, and it typically comes to try to balance an acidotic state. All right, so the brain is always sending out messaging to the kidneys, right, to and the adrenal glands to measure the amount of bicarbonate present in the blood, and then or the amount of oxygen and carbon dioxide present in the blood, and then bring about a balance. That's what it's all about: acid, base, and balance. And when there is an imbalance, that's what we're picking up on. All right, and showing that algorithm that we understand. All right, so a deficit of bicarbonate and other bases indicates metabolic acidosis. So the deficit of bicarbonate typically tells us that the patient's in an acidotic state, all right? And when there's an increase of the bicarbonates, we're typically dealing with an alkalotic state, okay? Usually there's a renal issue happening when we find our patient going through a metabolic acidosis or alkalosis. There's usually something happening with the kidneys, or perhaps there's even um, some dehydration happening. Future nurses, if you're serious about passing the NCLEX, click the link in my bio to visit the Coach Candace RN stand store and check out my NCLEX coaching program. You can access my 8-session NCLEX Prep course on a monthly subscription plan. Watch expert-led video lessons breaking down the most tested NCLEX concepts. Follow along with interactive slides to reinforce your learning. Perfect for both RN and LPN candidates preparing to ace the exam. As a bonus, grab my free Care Plans poster, your guide for understanding the top 8 priority scenarios most likely to show up on NCLEX. With your enrollment, you'll get a free digital study planner. Click the link in my bio now. stand.store/Coach Candace RN. So let us now just summarize what we just saw there. For pH, the normal range is 7.35 to 7.45. For PaCO2, the normal range is 35 to 45. All right, and that is going to be our respiratory determinant. For PaO2, remember 75 to 100 is perfectly okay. All right, notice I'm not really going too much into the units because NCLEX isn't going to give you or worry about you having to provide the units, so don't even get stuck on those, okay? HCO3, the normal range is 22 to 26. All right, if I didn't mention it here before, the normal range is 22 to 26. All right. Some people like to remember this by saying 2 plus 2 plus 2 equals 6. 2 plus 2 plus 2 gives you 6. So that's one way to keep up with the HCO3 as the metabolic determinant. All right. The normal range. All right. Oxygen saturation, 94 to 100. It's NCLEX typically giving you base excess? Not typically. Typically what you need to know, pH, PaCO2, and HCO3 to get where we're trying to go today. All right, so let's start with the goals. Actually, we only have goals 1 and 2 on NCLEX, all right? We have the goals of first finding out whether the patient is in an acidotic or alkalotic state, all right? Then we're going to find out if the patient is in a metabolic or respiratory alkalosis or acidosis, all right? But fortunately for NCLEX, we do not. I'm going to put a big X there in case you are not completely tuned in here. We do not have to know whether or not the patient is fully compensated, partially compensated, or uncompensated. All right. We just don't have to know that. Okay. All right. So just so that you understand that we are good to go on that point. All right. So good. We'll just have to focus on those first two goals. So Nurses Labs is great here with this graphic because it's really going to help you with memorizing the ranges, because really most of what you're doing here has to do with memorizing this scale. All right. But there's something first that you need to hone in on, and that's going to be that 7.35, you know this already, to 7.45 would represent the normal range as indicated by the white, all right, the white coloring here. All right, so as you get more into the red coloring, you're acidotic. As you get more into the blue coloring, you're alkalotic. So in your mind, you could mentally structure the normal blood pH scale here and have acidosis and alkalosis going in these two directions, where you're slightly acidic here as you go from the middle of normal range, which is 7.40. Okay, that is smack in the middle of normal. All right, so as you go more acidotic, all right, you're going to go red here. As you go more alkalotic or larger than 7.45, you're going to be in the blue range or alkalotic. Okay, that's important to know visually, all right, for those of you who are visual, and this may help. But when we talk about the respiratory state of the person and the ranges that let us know what normal looks like, we're still looking at 35 to 45. However, the larger the number when it comes to PaCO2, or the respiratory determinant, PaCO2, carbon dioxide, the larger this PaCO2, the more acidotic our patient will be. Okay, the smaller the number beyond or under 35, the more alkalotic the patient will be. We really should think about that, and we'll talk about it in a moment. All right, but just take one last look at this visual. HCO3, right, is the metabolic determinant. The smaller the number, just like with pH, the smaller the number, the more acidotic. All right, the larger the number, the more alkalotic, and not 35 to 45. All right, to remind us that the larger the number when it comes to the PaCO2, the more acidotic it is. All right, and the smaller the number, the more alkalotic the patient is. All right, so let's go back to where we were. All right, so that we can take a look at the second piece, all right, of the tic-tac-toe method that we really want to. Oh, I said I would talk really quickly about why PaCO2 has this difference in presentation, whereas the number gets larger and the patient's more acidotic. Well, let's think what's happening when a patient is hyperventilating. Okay, let's think about what happens when a patient is hyperventilating. I go back here so that you can quickly see, all right, what Nurses Labs has to say about PaCO2. Okay, so what happens with PaCO2 is that carbon dioxide is being let off constantly in a nice balanced way as we um, or the alveoli in our lungs, right, experience respiration, right, where the oxygen is being, uh, I'd say, absorbed or ventilated through the alveoli of the lungs. Okay, so I really don't want to get too deeply in it because I want us to focus in on what's happening when we're ventilating. All right, so CO2, though, cannot escape when, for some reason, there's damage to the alveoli. All right, or when the patient is hypoventilating. All right. So the patient doesn't breathe well enough. For some reason, oxygen exchange is not happening at the alveoli as it should. So we get a buildup of carbon dioxide. All right. Not enough oxygen being produced. There's a buildup of carbon dioxide. So the carbon dioxide can't escape. All right, it can't escape. So the more carbon dioxide, the more acidotic the state the patient is in. Okay, because the acid that's being formed is carbonic acid. All right, carbon dioxide, water forms carbonic acid, and that just happens when it can't escape the lungs. So, if a patient cannot breathe or ventilate properly, where they're expiring and getting a proper ventilated breath, all right, and they're hypoventilating, as can happen with patients with COPD. All right, it could happen with a patient who is obtunded or not, or a patient who's under the influence of narcotics and they're not breathing fully with a full breath. Okay, that patient's hypoventilating and could experience acidity or an acidotic state as the buildup of carbonic acid happens. All right. On the other hand, when the patient is hyperventilating, there is so much acid, or well, not acid, but carbon dioxide being let off, all right, that the patient, or ventilated, that the patient actually is experiencing an alkalotic state. All right, and usually when that happens, the kidneys want to kick in and increase the acidosis for the patient, or actually, there are some other things we might do if a patient is hyperventilating to capture more carbon dioxide, all right, to capture more acid, to build up more acid. We might have the patient breathe in a bag, perhaps a bag that won't let the CO2 escape so that they can capture that CO2 back in and bring about balance again. Okay, so keep that in mind. There is a quiz question that might ask you to consider that again. Okay, so I'm scrolling back down to where we were just so that I could give you a quick look at how we look at the respiratory scenario as a buildup of carbonic acid, and that's why we're going to get an acidotic state here. All right, whereas the larger HCO3 gives, that's a buildup of bicarbonate ion, or that stuff that's in baking soda? That's a base, and that is HCO3. It's bicarbonate, all right? And the buildup of that is alkalosis. All right, so here's the tic-tac-toe grid. The first row of the tic-tac-toe grid will be where you put the words acidosis, normal, or alkalosis. I can put sometimes AC, N, or AL, and that gets me there. All right, but we're mimicking this idea here, all right, where everything to the left on that grid will be acidosis, everything to the right on that grid will be alkalosis, and everything in the middle will be normal. Alkalosis, normal, acidosis. Okay, establish this off the top. Okay, this is what you're going to do. The second row here will have some numbers. The third row will have numbers as well. These numbers will be provided to you in the scenario of the question. All right. So let's think about the convention for these second row of numbers. Okay. The second row of numbers will always be pH. All right. And the pH will either be normal, smack in the middle at 7.4, or it will be under 7.4 and approaching the acidotic numbers. All right, so 7.35 and under. All right, or this number is going to be approaching the alkalotic numbers or greater than 7.41, right? Or it's greater than 7.45. All right. So from there, you're going to first determine where you're going to put your pH. All right. Are you going to put it in the acidotic column or are you going to put it in the alkalotic column? All right. Is it going to be in the acidotic column or the alkalotic column? That all depends on the number you're provided. Okay. So from there, you will make your first choice. All right. So after you've established your columns in the first row, you will appropriately put the pH in the second row. All right. There's only one space for the pH, and you're just using the actual abbreviation pH. All right. Because we'll know it's acidotic because we put it in the right column. All right. So that's the next step. So here we go with what happens after that. Okay. Where does the PaCO2 go? All right. Well, if it's above 45, we remember the patient's in an acidotic state because the larger the PaCO2, the more acidotic the patient. So PaCO2 will be acidotic. All right. If it's the patient's between that normal range of 45 to 35, then they'll be normal. All right. And if the PaCO2 is below 35, they'll be in the alkalotic range. Okay. Pretty straightforward. All right. So then we move on to HCO3. That's the last of the three numbers we need in order to make this tic-tac-toe method give us our proper result. All right, HCO3, is it below 22? It's acidotic. Is it in the normal range? Place it in the middle. Is it above 26? All right, then it is alkalotic. All right, put it in its right place. And then we solve for the first goal, which is whether or not this patient is in an acidotic state or alkalotic state. All right. So the convention is if the pH is acidotic, the patient's in an acidotic state. If the pH is alkalotic, the patient's in an alkalotic state. So goes the pH, so goes the patient. Okay, so that's an easy one. You're never going to have a pH that's alkalotic and then you turn around and give an answer that ends in acidosis. All right, and vice versa. You're never going to get a patient who is acidotic and then the type of acid-base imbalance ends with alkalosis. All right, so keep that in mind. So first, you're going to solve for that first goal, and then you're going to solve for the second goal. Is it metabolic or respiratory? What do we have going on with the patient? Well, here is the rule. So if the patient is found to be with pH and PaCO2 on the same column, then they're in a respiratory scenario. Okay? Specifically, they're in respiratory acidosis. If you find that the patient's pH and HCO3 are on the same side, well, then you'll be in metabolic alkalosis. All right. So it really is about which side pH is lining up with, and that's going to help you determine what's happening with your patient. Okay. Does that make sense? Now, we're not going to solve for compensation because we don't need to. So we're not going to take that look. Okay. All right. So we're really just determining if the pH is under the same column as PaCO2 or or HCO3. All right. And then from there, we can determine, all right, whether the patient is in a respiratory state or a metabolic state. And remember, whether or not they're in the acidotic or alkalotic state depends on where the pH is. You solve for that first. Okay. All right. So that is the method. Now, let us look back at our notes that we have for this particular lecture, and let's just go over a couple other concepts before we take a quick look at a few practice questions. All right, so with these acid-base imbalances, consider the scenario, okay? Consider the scenario. That's really going to help you the most when you're working with your clients, all right? And when I say consider your scenario, I say this. When the patient is being described with a lot of lung assessment terms, if you're hearing about the patient's respiratory rate, for example, if you're hearing about the patient's condition in terms of they're being short of breath, or perhaps wheezing, or any other type of scenario where the lungs might be prominent in their assessment findings, okay? Well, it's probably going to be a lung scenario if you were to just guess, all right? It's respiratory. And then just remember, so goes the pH, so goes the patient. So essentially, you would have that part determined by just looking at the pH. So, but if it's a lung scenario, there's a large chance, most likely, your patient is experiencing respiratory acidosis or alkalosis, all right? And just keep in mind that when they're overventilating, it's alkalosis, all right? Because they're overzealously using breathing techniques to bring about a lot of CO2 being let off, okay? And when there's a lot of CO2 being lost, the patient will end up in an alkalotic state. Remember, when there's a lot of CO2 being built up, as in underventilation, you're going to have an acidotic state. Now, patients who could have an alkalotic state typically will be those who are hyperventilating, panting, or perhaps people who are, going too hard on the childbirth Lamaze breathing techniques. Okay, so a little paper bag helps to increase the CO2 in the lungs. Breathing into the paper bag and having the patient suck the CO2 back into their lungs. Underventilation is near drowning, COPD, emphysema. Those are all scenarios where you might see underventilation. All right, you might get the over enlarged alveoli that come with emphysema, with the air pockets, and you will find that typically will cause damage, and that damage will cause the patient to not properly be able to exchange the gases, particularly oxygen, right, and CO2 at the alveoli level. So they're going to underventilate. Okay, maybe the patient's on a PCA pump and they are a bit overdosed, okay, and they're underventilating. If it, particularly these opiates will cause the patient to go into respiratory distress or underventilation. Okay, so whenever the CO2 cannot escape, there can be damage to the alveoli and you get acidosis. So think about the scenario that is being presented and you can really get to what you are dealing with. All right, so if it's not a lung scenario, or if there's not suction or vomiting happening, it's probably going to be metabolic acidosis. Okay, just that's the default setting we're going to set things to, metabolic acidosis, when it comes to the metabolic issues. All right, but first let's talk about NG tube dissection. All right, for 3 days, that patient's going to be in alkalotic state, okay, because they're losing all of their acidic GI contents to suction, all right? And especially when they're losing their GI contents for an extended period of time. For these women or pregnant moms with, well, they got moms until they have the baby yet, huh? So they're pregnant clients with hyperemesis gravidarum. All right, that's where they're, the morning sickness never stops. Okay, so the morning sickness never stops, and they find themselves to be in metabolic alkalosis after a while, right? Because of the dehydration and the electrolyte imbalance that's going on there. They actually Dehydration will cause acidosis originally or at first, but then the patient after a period of time will go into alkalosis. All right. Oh, let me clarify that. The patient is alkalotic, all right, but they become dehydrated, and that lends them to become acidotic, okay? Because dehydration should be a trigger for you to think metabolic acidosis, okay? Diarrhea leads to that. Um, you know, Dehydration in general will lead to acidosis. Acute renal failure, any of the renal issues are typically going to lead to acidosis. All right, third degree burns over the body, metabolic acidosis. All right, so if it's not a lung scenario, or if the patient hasn't had suction going for a while or constant vomiting for multiple days, then it's going to be metabolic acidosis. All right, hypovolemic shock, metabolic acidosis. All right, mostly because of the lactic acid accumulation. All right, and no oxygen, or hypoxia. All right, so think about what's going on with the patient that might lead to acidosis. All right, so here I just re-mentioned the some of the key information from nurses' labs, and now we're just going to take a quick look at the Google form questions that I have for you. I think it's about 7 questions, and we're going to just take a look at one of the questions so that we can think through how you might set it up. And then I want you to go through these questions on your own and come up with an answer. Just enter your email if you want this to return to you. All right. And then you're going to read through the question, which we're going to do right now. Future nurses, if you're serious about passing the NCLEX, click the link in my bio to visit the Coach Candace RN stand store and check out my NCLEX coaching program. You can access my 8-session NCLEX Prep course on a monthly subscription plan. Watch expert-led video lessons breaking down the most tested NCLEX concepts. Follow along with interactive slides to reinforce your learning. Perfect for both RN and LPN candidates preparing to ace the exam. As a bonus, grab my free Care Plans poster, your guide for understanding the top 8 priority scenarios most likely to show up on NCLEX. With your enrollment, you'll get a free digital study planner. Click the link in my bio now. stand.store/Coach Candace RN. I'm going to read through the question, and I'll make a few notes right on the screen here. All right, so you can see how you might set up your tic-tac-toe grid, all right, going forward. All right, so we have Mrs. Johansson, who's undergone surgery in the post-anesthesia care unit, PACU. It's difficult to arouse 2 hours following surgery. Nurse Florence in the PACU has been administering morphine sulfate intravenously to the client for complaints of post-surgical pain. The client's respiratory rate is 7 per minute and demonstrates shallow breathing. The patient does not respond to any stimuli. The nurse assesses the ABCs, remember airway, breathing, circulation, and obtains ABGs, stat. Measurement of arterial blood gas shows pH 7.1, PaCO2 70, HCO3 24. What does this mean? All right, so I want to give you a moment to think about how you might answer it. Maybe you're not using tic-tac-toe. Maybe you're still using Rome method. All right, well, let's go for tic-tac-toe. All right, so you're going to first just establish your tic-tac-toe pattern. All right, and as I mentioned before, I like to put AC on my acidotic side, N for normal, and then AL on my alkalotic side. All right, and then I maybe write down the ranges so that I can remember 7.35 to 7.45. Apologies for my scratchy writing. That's pH. All right, PaCO2, I'm going to remember 45 to 35 because that's going to help me keep up with the larger number being acidotic and the bottom number being, or the smaller number being alkalotic. And then finally, I'm going to put up here the 22 to 26 bicarb range. All right, 2 plus 2 plus 2 equals 6. Okay, the lower the number, the more acidotic, the higher the bicarb, the more alkalotic. So what do we have here? We have a pH of 7.1. What is that? Acidotic, normal, or alkalotic? All right, well, if you said acidotic, you are correct. The pH goes here, okay? PaCO2 of 70. All right, if the PaCO2 is 70, is this patient alkalotic, normal, or acidotic? All right, well, if you said acidotic, because 70 is much larger than 45 and therefore puts this patient on the acidotic side, then you are correct. PaCO2. All right, we can already see a pattern emerging here, but let's take a look at the HCO3. It's 24. Well, the HCO3 is in the normal range, smack in the middle of it. All right, so you would then put HCO3 in the normal range. All right, so where are you matching up? Here. All right, so you know that your patient is in an acidotic state. All right, you know that because the pH is here. All right, so we check out the pH first and we automatically know that the answer cannot be A, it cannot be C, because it has to be acidotic, okay? And then we solve the question of whether or not this is a respiratory or a metabolic scenario going on. Well, we have two ways to do that. We could just look at the scenario and see, does it seem like a respiratory scenario? Do they mention anything that appears to be a concern for the respiratory system? Well, I see some shallow breathing. I see the respiratory rate is 7 per minute. All right. So with that said, I might think this was respiratory acidosis, but I'm going to use my tic-tac-toe method to confirm or deny. All right, and it looks like over here that whenever the pH is matched up with the PaCO2, then that's the respiratory determinant. So we have a respiratory scenario. If the pH was matched up somewhere with HCO3, then we would have had a metabolic scenario. So we're going to go with respiratory acidosis. All right, does that make sense to you? All right, give you a chance to take another look at that. All right, so thank you for your time and attention today. All right, and I would love for you to go through the rest of the questions and see where you stand, okay? Let's just go through this one really quickly because I love the logic questions as well as the others. Let's just see how you're thinking, all right? Mr. Salcido has the following ABG values. pH, 7.3, all right? Partial pressure of arterial oxygen, 80, all right? Arterial carbon dioxide, 49, and bicarbonate, 24. Use your method to come to your answer, all right? Based on the results, with which intervention should the nurse implement? All right, so it's not asking you which acid base imbalance they have. You're going to have to figure that out quickly. But then which intervention should the nurse implement? Another type of question you might get around ABGs. All right, so with that said, let's first figure out what we have going on here. All right, so it looks like, I'll give you a second to work with it while I just type here or write here on screen what we have. All right, we'll do quick tic-tac-toe, but I think you probably know what's going on here with Mr. Salcido. All right, acidosis on the left, alkalosis on the right, normal in the middle. Okay, the pH 7.34. The rule is 7.35, right? Or less gets you an acidotic state. So they're kind of just heading over into the acidotic state, okay? Just a little bit, all right? Almost like normal. So they're kind of heading into that way, okay? So the partial pressure of arterial oxygen, nice to know, but not extremely necessary to know, but they're actually great, right? Between 75 and 100, they're great, right? Don't get it fooled with the SpO2 or the partial pressure of, well, that's not partial pressure, that's the oxygenation or the SpO2 oxygen saturation. Don't get it mixed up with that one because that would be pretty low if that was SpO2. All right, but this is partial pressure of arterial oxygen and it looks fine. All right, carbon dioxide though, where are we with that? Well, remember your values, right? 45 to 35. All right, this is greater than 45, so this is acidotic. So we'll just put CO2 here. And we already know with that normal bicarbonate, all right, of 24, that we are working again with respiratory acidosis, okay? So whenever we have respiratory acidosis, there's a buildup of carbonic acid in the lungs that we need to let off, all right? We need to off gas in some way. So how are we going to do it with this client? Okay, how are we going to do this? Give you a second. Are we going to instruct the client to breathe slowly into a paper bag? All right, are we going to administer low flow oxygen? Are we going to encourage the client to cough and deep breathe? Or are we going to do nothing because these ABG values are within normal limits? Oh, I just love this question because it's giving me an opportunity to go back to a concept that I have told you early and I told you I would tell you often. So let's see what you did. We need the patient to cough and deep breathe. All right. We need to let them let off a little bit of their bicarbonate. Let off a little bit of their uh, carbonic acid, all right, or the CO2, so that they don't have this buildup that's happening right now. All right. Actually, if we were to have had them breathe slowly into a paper bag, do you know what would have happened? They would become more acidic. The pH would go up, and so would the carbonic acid, right? Because it would be pulling back in. So they're not hyperventilating, they are hypoventilating because there's a buildup of carbonic acid. So we just need them to cough and deep breathe, and that will cause them to let some of that carbonic acid out. All right, was I clear with you on that? I hope so. All right, I hope that makes sense. No low flow oxygen, no, that does not work here. And don't do nothing. All right. We never pick the do nothing choice. Remember that. We never pick the do nothing choice. We see that as a trick. And we look back at the question and go, well, how can I interpret this appropriately? A little cough and deep breathe would be just fine for this client. And it would demonstrate to the algorithm that you know how to catch an emerging crisis before it becomes a crisis. All right, well, go ahead and finish those questions and submit them so that you can see your score. And I hope that it is a good score for you because you appreciate this lecture, all right, and that you have been able to work with the Nurses Labs content here. Please feel free to go back to the Nurses Labs content and engage with it. Nurses Labs also has some practice questions that you can do that are right around this topic of ABG blood gas interpretation. Okay, so if you want a few more questions there, feel free to do the practice quiz there. All right, just scroll down till you see I think you may have to click on it here and you can engage with those. Okay. All right. Well, nice working with you and take care. Future nurses, if you're serious about passing the NCLEX, Click the link in my bio to visit the Coach Candace RN stand store and check out my NCLEX coaching program. You can access my 8-session NCLEX Prep course on a monthly subscription plan. Watch expert-led video lessons breaking down the most tested NCLEX concepts. Follow along with interactive slides to reinforce your learning. Perfect for both RN and LPN candidates preparing to ace the exam. As a bonus, grab my free Care Plans poster, your guide for understanding the top 8 priority scenarios most likely to show up on NCLEX. With your enrollment, you'll get a free digital study planner. Click the link in my bio now, stand.store/Coach Candace RN.